Hello, this is a brief and short video to introduce you to the assembly of the pediatric STOTS bronchoscopes for use in children. So what you see on the table here are essentially all the equipment that we should need in most cases of examination for diagnostic purposes and for intervention. You see on the table three lengths of STOTS bronchoscopes: 18 centimeter, 26 centimeter, and 30 centimeter. You're about to see the adapter being fitted to the end of the bronchoscope of the 30 centimeter bronchoscope, and a lens can then be locked in and secured. We then fit on the other adapters as well as the light source, which is normally fitted directly to the glass lens. The light prism is fitted to the side port just in case it is needed. It's only used with the lens removed. What I'm pointing out here is the side port, which can be used for suction or for the delivery of laser via the appropriate fiber. If the glass lens adapted to a camera, we can operate in glorious Technicolor with good illumination and magnification. Generally, we keep the suction tip right next to the lens, acting almost as a wiper. This is the optically guided peanut forceps. Although it is called the peanut forceps, it is suitable for removal of all kinds of foreign bodies in the bronchi: vegetables, beets, and of course peanuts. A glass lens can be adapted to it and locked in. With the light source fitted, we can see exactly where the foreign body is and appropriately slide the flanges onto the sides of the foreign body and grip it securely and have it removed from the airway. It can either be directly inserted to the airway or via a bronchoscope, which allows ventilation alongside the intervention. The smallest size STOTS scope is 3.5 for the peanut forceps to be inserted, and of course it can be inserted to larger bronchoscopes. To facilitate the insertion of instruments, which could be lenses, which could be bronchoscopes, we have these Benjamin slotted laryngoscopes. It's got a ventilation port, which allows a width of air or oxygen to buy time while we insert instruments or intubate. A lens can be inserted via the slot for a quick examination, and of course a ventilating bronchoscope can also be inserted into the airway with the laryngoscope removed. We can then examine in the airway in comfort. These laryngoscopes have the light delivered in two ways. The first is via a prism that can be inserted through the handle shaft of these laryngoscope. And the second way is via a clip-on light source we call the Benjamin Havis clip that goes on to the lower flange of these laryngoscopes. It's very bright. It also allows quick change of bronchoscope should we need to. This is a larger scope, or to a Lindholm operating laryngoscope, just like this. Simple clip-on. This is a smaller laser scope for smaller children. In very difficult airway, with difficult jaw, to facilitate intubation, we have these super slim scopes. They are very helpful. They can go on the side of the tongue right to the larynx, allow a more controlled intubation in jaw that doesn't open fully.